7 parts of your business change when you turn a group practice into an IOP or PHP in Arizona. Licensing, space, staffing, payer enrollment, documentation, admissions, and billing, all before you advertise a higher level of care. A professional group practice is not automatically an Arizona outpatient treatment center, and an IOP is not just a longer appointment block. Here is how to evaluate the conversion before you market the program or commit capital. The strategic opening is real. Arizona has meaningful demand across Phoenix, Tucson, suburban growth markets, rural communities, and tribal regions. You may already see clients who need more structure than weekly therapy, but who do not need residential care. The opportunity is converting an existing clinical platform into a structured outpatient program. Stronger intake, scheduling, documentation, utilization review, and care coordination. Here is the cost of skipping the diagnostic. Revenue assumptions become part of the launch story before the gaps are found. A conversion plan must identify payer, credentialing, authorization, documentation, and claims risk gaps before revenue assumptions become part of the launch story. And before you market a higher level of care, the licensing question has to be resolved, not assumed. Your existing therapy EHR may not be enough for a converted program. Behave Health's EHR, CRM, and RCM are designed around facility workflows. Program schedules, treatment plans, and group nates in one system. Authorization tracking for the payer conversations a program-level operation runs on. Plus admissions follow-up and billing controls designed to support program-level operations. Before you advertise the program, 4 questions have to be resolved. Let's take them in order. Licensing, staffing, space, and payers. Question 1. Does your program cross from ordinary professional outpatient practice into a licensed healthcare institution or outpatient treatment center model? The ADHS Bureau of Behavioral Health Facilities Licensing is the state source for current facility licensing resources. Arizona's healthcare institution rules are published in Arizona Administrative Code, Title 9, Chapter 10. A structured program means a defined scope of services, group treatment, program-level administration, patient rights obligations, and payer-facing level of care documentation. Question 2. Staffing. A group practice often has strong clinicians but thin program infrastructure. IOP and PHP operations usually require clearer clinical leadership, level of care thinking, care coordination, payer documentation, and quality oversight. Decide what clinical problem the program solves first. An adult substance use IOP in Phoenix raises different questions than an adolescent co-occurring PHP. Question 3. The facility. Many practices hope to stay in the same office. Test that against the program model before you commit. An IOP or PHP location supports a different level of clinical intensity, privacy, group care, and patient flow than a one-on-one therapy office. If the space was designed for private appointments, treat the facility question as an early feasibility issue, not an afterthought. Question 4. Payers. Arizona's Medicaid program, AHCCCS, belongs in the payer readiness conversation early. The AHCCCS Fee-for-Service Behavioral Health Manual lists partial hospital program and intensive outpatient program among covered behavioral health service categories. That does not mean a newly converted program can bill immediately. Verify provider enrollment, program credentialing, medical necessity criteria, documentation expectations, and authorization review before relying on the revenue model. Use the national guides on IOP billing codes to frame the billing conversation before you build payer workflows. Start with H0015, H2036, S0201, and S9480. And remember, group practice billing and program billing are not the same business process. Phrases like Arizona IOP licensing requirements are useful discovery terms, but they may not match the state's exact categories. Resolve which agency has authority and what service definition applies. Whether the group practice model still fits, and what must be true before marketing. The right next step is a scoped review of your proposed model, not copying another provider's launch path. Stop marketing a higher level of care before the model is ready. Scope the conversion with Behave Consulting. Book a 20-minute demo at behavehealth.com. Behave's credentialing, EHR, CRM, and RCM tools support the program once the model is ready to operate.